Welcome to our comprehensive exploration of type 2 diabetes mellitus, a chronic condition that significantly impacts millions worldwide. In this video, we will delve into the intricate mechanisms underlying this disease, the challenges it presents, and the strategies for effective management. Understanding type 2 diabetes is crucial, not only for medical professionals, but also for patients and caregivers, as it empowers them to make informed decisions about treatment and lifestyle changes. We will explore various aspects, from insulin resistance and beta cell dysfunction to lifestyle modifications and pharmacological interventions. By the end of this video, you will have a thorough understanding of how these elements interact to influence the progression and management of diabetes. This knowledge is vital for improving patient outcomes and reducing the burden of this disease on individuals and healthcare systems. Now that we have set the stage, let us begin our journey by examining the pathophysiology of type 2 diabetes, which is the foundation for understanding its complexities and the basis for developing effective treatment strategies. Type 2 diabetes mellitus is a chronic condition marked by high blood sugar levels due to insulin resistance and a relative lack of insulin. This condition is intricately linked to the dysfunction of pancreatic beta cells, which progressively lose their ability to produce sufficient insulin. Understanding the pathophysiology of type 2 diabetes is crucial as it helps in comprehending the related complications and devising effective treatment strategies. These complications often arise from chronic hyperglycemia and can significantly impact a patient's quality of life and increase healthcare burdens. By understanding the underlying mechanisms, healthcare providers can tailor interventions to address these issues early on, potentially preventing the progression of the disease. This foundational knowledge is pivotal for advancing research and improving clinical outcomes. Now that we understand the basic pathophysiology, we can explore how insulin resistance plays a central role in this condition. Insulin resistance is characterized by the diminished ability of cells to respond to insulin, leading to impaired glucose uptake. It is a central feature of metabolic syndrome and plays a significant role in the development of type 2 diabetes. This condition not only contributes to obesity and metabolic disorders, but also increases the risk of cardiovascular diseases. Recognizing the role of insulin resistance in chronic diseases underscores the importance of early intervention and lifestyle changes to improve insulin sensitivity and reduce associated health risks. By addressing insulin resistance through dietary modifications and physical activity, patients can significantly improve their metabolic health. This understanding highlights the necessity for healthcare providers to focus on preventive measures and patient education. With this foundation in place, we can move on to examining the decline in beta cell function and its implications for diabetes management. Beta cell dysfunction involves the progressive inability of pancreatic beta cells to produce sufficient insulin, which is integral to the progression of type 2 diabetes. This dysfunction is closely connected with insulin resistance and significantly impacts the efficacy of treatment plans. As beta cell function deteriorates, diabetes control worsens, necessitating more intensive medical management. Understanding the progression of beta cell dysfunction emphasizes the need for early detection and tailored therapeutic approaches to preserve beta cell function and improve patient outcomes. This knowledge is crucial for developing strategies that target beta cell preservation and enhance insulin secretion. By focusing on these aspects, healthcare providers can better manage the disease's progression and improve long-term patient outcomes. This brings us to one of the most important aspects of our topic: the role of adipokines in metabolic health. Adipokines are proteins secreted by adipose tissue that play a crucial role in regulating insulin sensitivity and various metabolic processes. These proteins are closely related to insulin resistance and metabolic syndrome, providing potential therapeutic targets for treating metabolic diseases. Understanding the complex role of adipokines in metabolic health not only influences public health strategies, but also guides individual patient care. This knowledge motivates further research into obesity-related interventions and the development of new treatment avenues. By targeting adipokines, healthcare providers can potentially modulate insulin sensitivity and improve metabolic outcomes. This approach underscores the importance of integrating research findings into clinical practice to enhance patient care. Now that we have explored the role of adipokines, let us examine the glycemic criteria used for diagnosing diabetes and their implications for treatment. Glycemic criteria involve specific blood glucose levels used to diagnose diabetes, and are essential for confirming the presence of type 2 diabetes in clinical practice. Accurate diagnosis using these criteria is crucial as it directly impacts treatment decisions and patient prognosis. Understanding and applying glycemic criteria effectively can influence healthcare delivery and policy, emphasizing the importance of early and accurate diagnosis to prevent complications and improve patient outcomes. By adhering to these criteria, healthcare providers can ensure that patients receive appropriate interventions promptly. This approach highlights the critical role of diagnostic accuracy in managing diabetes effectively. With a clear understanding of glycemic criteria, we can now turn our attention to the pharmacological management of diabetes, starting with metformin, a cornerstone medication in diabetes care. Metformin is a cornerstone medication in the management of type 2 diabetes, primarily functioning to decrease liver glucose production and enhance insulin sensitivity. It works synergistically with lifestyle changes and other medications to control blood sugar levels effectively. Metformin not only improves patient quality of life by reducing the risk of complications, but also fosters patient adherence through a better understanding of its benefits and potential side effects. Reviewing pharmacology and clinical guidelines for metformin use is essential for healthcare professionals to optimize treatment plans. By understanding the mechanisms and benefits of metformin, providers can tailor treatment strategies to meet individual patient needs. This comprehensive approach ensures that patients receive the most effective care possible. Now that we have discussed metformin, let us explore the microvascular complications associated with diabetes and the importance of glycemic control in preventing them. Microvascular complications are diabetes-induced damages to small blood vessels, leading to conditions such as retinopathy, nephropathy, and neuropathy. These complications are directly linked to chronic hyperglycemia and poor diabetes control. Understanding these complications is vital for providing comprehensive care to diabetic patients, as they significantly affect quality of life and increase healthcare costs due to chronic management needs. Emphasizing the importance of tight glycemic control can help prevent long-term complications, highlighting the need for regular monitoring and proactive management strategies. By focusing on glycemic control, healthcare providers can reduce the incidence of these complications and improve patient outcomes. This understanding underscores the necessity for continuous patient education and engagement in the management of diabetes. With this foundation, we can now discuss the macrovascular complications and preventive strategies in diabetes care. Macrovascular complications involve damage to large blood vessels, significantly increasing the risk of heart attacks and strokes in diabetic patients. These complications are a major cause of morbidity and mortality, impacting both patient and family well-being. Addressing macrovascular complications requires comprehensive cardiovascular risk management, integrating preventive healthcare strategies into diabetes care. Healthcare providers must focus on designing preventive care plans that address these risks, utilizing cardiovascular risk assessment tools, and engaging in interdisciplinary learning with cardiology to optimize patient outcomes. By implementing these strategies, providers can reduce the incidence of macrovascular complications and enhance the quality of life for diabetic patients. This comprehensive approach emphasizes the importance of preventive care in managing diabetes. Now that we have explored macrovascular complications, let us examine the role of lifestyle modifications in diabetes management. Lifestyle modification is a fundamental aspect of diabetes management, involving changes in diet, exercise, and weight management to control diabetes effectively. These modifications complement pharmacological treatments and play a crucial role in reducing the risk of complications. Empowering patients to take control of their health through lifestyle changes not only improves outcomes, but also reduces dependency on medication. Healthcare professionals should encourage participation in workshops on nutrition and exercise and promote the use of tracking tools to monitor progress and motivate patients. By fostering a supportive environment, providers can enhance patient adherence to lifestyle changes and improve overall health outcomes. This comprehensive approach underscores the importance of lifestyle modification in diabetes care. Now that we have discussed lifestyle changes, let us explore the role of SGLT2 inhibitors in diabetes management and their additional benefits. SGLT2 inhibitors are a class of medications that increase glucose excretion through urine, offering significant cardiovascular and renal benefits beyond glucose control. These inhibitors work alongside other diabetes treatments, making them an important component of comprehensive diabetes care. By providing additional benefits, SGLT2 inhibitors improve patient outcomes and quality of life, encouraging healthcare providers to consider holistic treatment approaches that address multiple health aspects. Staying informed about emerging research on SGLT2 inhibitors and engaging in clinical trials can further enhance treatment strategies. This understanding highlights the potential of SGLT2 inhibitors to transform diabetes management and improve patient care. With this knowledge, we can now integrate these concepts into a cohesive management plan for type 2 diabetes. The management of type 2 diabetes requires an understanding of interconnected concepts such as insulin resistance, beta cell dysfunction, and lifestyle modification. Each of these elements plays a critical role in developing comprehensive treatment strategies that address the multifaceted nature of diabetes. By integrating these concepts, healthcare providers can devise personalized management plans that optimize patient outcomes. This holistic approach not only improves glycemic control, but also reduces the risk of complications, emphasizing the importance of a well-rounded understanding of diabetes pathophysiology and treatment. By fostering collaboration among healthcare professionals, patients can receive comprehensive care that addresses all aspects of their condition. Now that we have explored comprehensive management strategies, let us focus on the importance of continuous learning and professional development in diabetes care. Continuous learning and adaptation are essential for healthcare professionals involved in diabetes care. Staying updated with current guidelines and research articles ensures that practitioners can provide the most effective and evidence-based treatments. Engaging in professional development activities, such as workshops, case discussions, and interdisciplinary learning helps identify gaps in understanding and fosters the development of new skills. By committing to lifelong learning, healthcare providers can enhance their ability to manage diabetes effectively, ultimately improving patient outcomes and advancing the field of diabetes care. This commitment to continuous learning is vital for adapting to evolving treatment paradigms and ensuring the highest quality of care for patients. With this focus on professional growth, we conclude our exploration of type 2 diabetes with a summary of key points and a call to action. As we conclude this comprehensive exploration of type 2 diabetes, we have covered the critical aspects of its pathophysiology, management, and the importance of continuous learning. Understanding insulin resistance, beta cell dysfunction, and the role of lifestyle modifications are essential for effective disease management. Pharmacological interventions like metformin and SGLT2 inhibitors offer significant benefits, enhancing patient outcomes. By integrating these elements into a cohesive management plan, healthcare providers can improve patient care and quality of life. Continuous professional development ensures that practitioners remain at the forefront of diabetes care, adapting to new research and treatment strategies. We hope this video has provided valuable insights and encourages you to apply this knowledge in practice. Thank you for joining us on this journey to better understand and manage type 2 diabetes.